How to talk to your teen about mental health and depression without saying mental or depression. Hey, I understand that ups and downs are a normal part of growing up. I also understand that it's difficult to distinguish normal teenage moodiness versus depression. Many teens, probably yours, they have trouble articulating what they're going through, and they probably don't want to talk about it either. And certainly not to you, you're the parent. But teens need two questions answered. Do you care about me? And can I trust you? You answer these two questions every single day, and you have a better chance of your teen opening up to you. Rates of teen depression increase sharply during adolescence, peaking around 16 years old. And the exact reasons for the rise in depression during this time is unknown, but it's widely accepted that a number of factors contribute, including social transitions, academic and social stress, hormonal changes. I think social media, cell phones, the internet, I think we've given them rights and privileges that we as a society have given them, and yet they're capable of emotionally handling the stresses that come with these different platforms. Also, the expectations of parents, teachers, schools, and the pressures that they're putting on themselves. And for what? I mean, they're 16, really? Add to this their developmental goals of figuring out who they are, where they fit in, and establishing their independence. And my friends, it's clear that teens have a lot going on in their lives. Parents, you play the most significant role in the self-esteem of your teen than any other adult. Yet, when I ask teens who their number one trusted adult is, rarely is it their own parents. Sad. Here's the conversation that I hope will help protect your teen. One of the best things you can do for your teen in your life is to let him or her know that you're available to talk on their terms, So here are some ideas for how to make that happen. Number one, be present. That's right. Let them know you're there, and that you're there for them unconditionally whenever they want. No limits. Be careful not to ask too many questions, though. You don't want them to feel crowded, lectured, patronized, or that you're trying to fix their thoughts and emotions. Folks, we don't fix kids, we fix cats and dogs. Let them feel, but let them figure it out, knowing you're always there to listen and offer advice if they want. But ask permission first. Always validate their feelings. Number two, send invitations. Starting the conversation, it's the easiest part, or it should be. Here's a few ideas to get things started. Are you okay? I'm here if you ever want to talk. You know, it's really normal to feel stressed, sad, cranky, and even tired at times, but if it gets to the point where you're feeling like that all the time, we should probably talk about it. You don't have to feel like this, and there are ways to feel better. I'm here, and I'd love to listen to your heart and offer some suggestions. You seem a bit down lately. Stressed, tired. Is that how you're feeling at this moment? And then depending on the answer, would you like to talk about it? Or, listen, I'm here if you ever need to talk. Number three, validate them. Acknowledge to your child that high school can be a tough time and that it's all part of the process and growing up. Acknowledge the things that might be going on. Like, hey, I know that you want to do well, so I understand that you might feel the pressure of school, sports, trying to fit in. Everyone's going through the same thing. And so there might be some crazy stuff that happens with your friends, social environments. I get it, it's normal. But I'm here if you ever want to talk. Number four, give them an easy way out. So instead of a car trip being about you, the chauffeur, have the whole trip in the car as a time limit so that they know there's an easy end to any difficult conversation and that they have control. Let them know that you'll only talk until you pull in the driveway, and then they can decide if they want the conversation to keep going or not. Completely up to them. No questions or argument from you. So it can be like, do you think we can talk about things while we're traveling? Let's do it like this. Let's chat until we pull in the driveway, and then I promise we'll talk about something else if you want to. Totally up to you. That's good, huh? Number 5, your physical presence can make a difference. This can depend on the teen and the situation. Sometimes your teen might respond better if you avoid eye contact. Try starting the conversation in the car or while you're doing something else like cooking dinner rather than when you're sitting down and you're facing them. I'm listening. And there might be other times when they'll appreciate the one-on-one close attention from you. Maybe at night before bed, when you're sitting on the edge of the bed. This is a great time. Trust, respect. It's late, dark outside. Turn the phones off. Don't even have them with you, mom, dad. The rest of the world seems a bit more removed. No distractions. No expectations. They won't always talk, of course. Sometimes they'll have nothing to say or they might not feel like talking. But if they're going to talk, this seems to be the time when they do. Number 6, be gentle but persistent. Be available but not intrusive. Your teen might not open up straight away, and that's okay. Keep trying, but be mindful of pushing too hard. This is a tricky line. The main thing is to keep making yourself available for when they are ready. Number 7, don't try to talk them out of their depression. Even if their thinking seems irrational or their thoughts trivial, it isn't that way to them. Validate them. It's bothering you, isn't it? Or, I can see how upset you are. So they know that they can come to you again, mom, dad. Teenage depression, the warning signs. Knowing the warning signs is important because with early detection, plenty can be done. If you're not sure whether the teen in your life is depressed or just going through the usual growing pains that come with adolescence, consider the duration and severity of the symptoms and how different your teen is acting from his or her usual self. Teenage depression can look similar or very different to depression in adults. The usual signs of depression, right here, right now. Mood changes, sadness or irritability, a sense of hopelessness, tearfulness or crying, withdrawal from social and family relationships, a loss of interest in activities, changes in their sleep habits, maybe they're sleeping more or less, change in waking time, later, earlier, during the night, changes in appetite and eating habits, restlessness, feelings of worthlessness and guilt, lack of enthusiasm or motivation, tiredness and fatigue, difficulty concentrating, suicidal thoughts. For teens, the warning signs can look different to this. They may be negative, cranky, irritable, angry, easily frustrated, or prone to outbursts. Often, depressed teens come across primarily as irritable and cranky more than just sad. They may complain of aches and pains such as headaches or tummy aches for which there is no medical explanation. They may feel misunderstood or highly sensitive to criticism because of their feelings of worthlessness. They feel alone, depressed. Depressed teens can be extremely sensitive to failure, rejection, or criticism. Overachievers are particularly vulnerable. They might withdraw from some, but not all, of their relationships. Depressed adults tend to pull away from relationships generally, but the withdrawal is not as clear in teens. Teens might pull away from some and keep others, start mixing with a different crowd, or just pull away from their parents. There may be problems at school, Difficulty concentrating and low energy may lead to attendance problems, poor grades, and frustration with schoolwork and previously good students. Drug and alcohol abuse. Low self-esteem that might play out as expressions of ugliness, shame, unworthiness, and failure. They may spend excessive time on the computer. They may engage in risky behavior, recklessness, drinking, unsafe sex. But remember that these warning signs can look like a normal part of adolescence, and in many cases, that's exactly what it will be. The symptoms exist on a spectrum, and the main thing is to be alive to the duration and severity of the symptoms and the departure from whatever is normal for your teen. So if you suspect your teen is depressed, take all signs seriously. And the most important thing is to let them know that depression and anxiety is treatable. The sense of helplessness that comes with depression doesn't only touch those who are struggling with depression, but also those who love them. Know that even if it doesn't seem as though the things you are doing are making a difference, I promise you they are. So for ways to support your teen, if he or she is struggling with depression, there's plenty. Doctors, your primary care physician. Don't be afraid. Therapy. Things can change. They won't always feel the way they do today. Let them know this. It's critical and will make a difference. And if there's any chance your teen might be suicidal, ask them directly. If they're having thoughts of suicide, ask them. Many people avoid this question for fear it will put an idea in their head, but it won't. I promise. It might be the most important question you will ask them. And if they're suicidal, help them seek professional help right away to a counselor, doctor, hospital, 911. Help them to challenge the negative thinking that contributes to depression. Exercise can protect against depression, and for mild to moderate depression, exercise causes the same changes in the brain as antidepressants. A 20-30 minute walk 5 times a week will make a difference. Have your teen assessed by a doctor to determine whether or not medication is appropriate. Medication can be very effective, but the effects of antidepressants on the adolescent brain aren't fully known. So this is where close monitoring is important, particularly in the first couple months of treatment, to pick up any worsening of symptoms, suicidal thinking, or further changes in mood or behavior. And if medication is recommended, it should always be used as part of a wider treatment plan that includes counseling to equip them with the skills to protect themselves from further depression, and lifestyle factors such as diet, exercise, mindfulness. Huge. Medication isn't a magic bullet, and changes generally won't be seen for at least a few weeks. My friends, understand that depression is physiological. It's not a deficiency in personality or character. Living with a depressed teen might expose you to rejection, conflict, despair, and extreme sadness yourself. And living with someone who is depressed requires a heroic effort from those who love them. Understand that your teen is still your child that you've always known. And they aren't pushing you away or hurting you on purpose. They're hurting. It's just what depression does. So do whatever you can to accommodate your teen socially. One of the symptoms of depression is withdrawal from relationships, but isolation will make their depression worse. Anything you can do to support them in maintaining friends or getting out will be important. Be patient. Don't compare. Depression can take aim at anybody. It's not a reflection on parenting or personality. The most loving, involved parents can have a teen with depression. It's chemical. It's important for your own sake that you don't compare yourself or your family to others. Your teen will come back. Be patient and don't be disheartened by temporary setbacks. This is a normal part of the recovery. And finally, I've yet to meet a parent who isn't racked with self-doubt now and then, wondering if they're getting it right. Adolescence seems particularly adept at taking any self-doubts we have and flourishing them to spectacular, epic proportions. Whether your teen is depressed or not, if you're aiming or rather arming yourself with information and making yourself available, know that you're doing what they need you to do. They're lucky to have you. Deep down inside them, whether they show you or not, they know it too. Parents, keep doing an awesome job. Always be present and available for your child. Make sure it's on their terms. Trust and respect. Balance. Patience in the process. Always give them hope. That's right. I'm Jeff Yalden. I appreciate you listening to this message.